Psychiatric Mental Health Nursing Case Studies, Volume 1. 100 Real-Life Scenarios for Clinical Practice in Mood, Anxiety, Psychosis, and Personality Disorders with Nursing Assessments, DSM-5 Diagnoses and Care Plans. By Megan Christie Nelson and Mallory Philomena Lawrence. And narrated by Mary G. Disclaimer. This book is intended for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Readers should always consult qualified health professionals before making decisions related to clinical care, patient treatment, or mental health intervention. The case studies, names, identifying details, and narratives included in this book have been created for the purpose of clinical education and learning. While inspired by real-world clinical patterns, they are not based on actual individuals or events. Any resemblance to actual persons, living or dead, is purely coincidental. The author and publisher make no representations or warranties with respect to the accuracy, applicability, or completeness of the contents of this book. They disclaim any liability for any medical, legal, or other outcomes resulting from the application of information presented herein. Use of this material is at the reader's own discretion and risk. This book is not intended to replace supervision, clinical judgment, or institutional policies. Students and clinicians are encouraged to follow local protocols, licensing regulations, and the guidance of experienced mental health professionals. Preface. The work of a mental health nurse is not for the faint of heart or the vague of mind. Every shift may call for calm presence in chaos, humor in tension, and the ability to read both silence and noise with equal attention. Psychiatric Mental Health Nursing Case Studies, Volume 1 was written to bring that reality to life, sharply, clearly, and practically. This volume contains 100 real-world case studies, centered around some of the most common and complex psychiatric presentations nurses encounter. From mood disorders like depression and bipolar disorder to anxiety conditions, psychotic symptoms, and challenging personality dynamics, each case offers more than symptoms on a list. It gives you a clinical story. One you might recognize. One you may have lived through on a unit. Or one you'll face soon, whether in clinical training or in your role as a practicing nurse. These cases are structured for both learning and clinical reflection. Each follows a consistent, evidence-based.
Sample complete. Ready to continue?